This original WSRE presentation is made possible by viewers like you. Thank you.
An injury ended his football career, but it launched the career of a world-renowned surgeon and medical researcher, Dr. Lonnie Paulos, on this edition of Conversations. I'm Jeff Weeks. Thank you for deciding to spend some time with us. Interesting edition of Conversations. This time around, we are pleased to welcome Dr. Lonnie Paulos, who is with the Andrews Institute. Now, anybody that knows anything about sports knows about Dr. James Andrews and the Andrews Institute, but let me get you to kind of tell us how you fit into the scenario.
Jim and I are friends from many years ago. The idea of a sports medicine clinic and a sports medicine approach to athletic injuries really started in the late 70s, and Jim and I were at opposite ends of the country kind of establishing the same type of programs wherein you bring in physicians who are particularly interested in sports injuries, physical therapists, athletic trainers, and you would form a team in order to win the confidence of the athletes so they knew that you were there to help them get back quickly but safely. And so on the West Coast, I was sort of instrumental in putting together some sports medicine efforts, particularly with the snow skiing, the U.S. ski team, and the snow sports. And Jim was more of a baseball, football on the East Coast. And so we've known each other for years. Part of those programs are always very much run by an academic approach, meaning that there's research, there's education for other surgeons, medical students, the public in general. And we got to know each other on various panels or educational panels, and ultimately became good friends.
And there's also an educational arm to it as well, is that correct?
Correct. Both for the public as well as the coaching staffs, athletes, other physicians, certified athletic trainers. We host a number of different conferences and educational programs that will teach the paraprofessional as well as the professionals, and then the public as well. Many public programs just so that they're more aware of what's available and the good and bad of all the various injuries that occur.
Okay, and that's the Andrews-Paulos Institute,
right,
which is a part of the... Right.
Exactly. I came about, it's been almost 2 years now. I was actually, it's a long career. When you specialize in something besides medical school, you then you'll do a year of internship, and everybody's familiar with that now because all the TV programs and the ERs. And,
right.
But then you do a residency wherein you become a heart surgeon, a general internist, orthopedic surgeon, and then other training after that. It's called fellowship training. And sports medicine became very specific many years ago in providing these fellowship opportunities. And so those of us that participated in those early on then became teachers later. And that's how basically you earn your credentials.
I know Dr. Andrews, for example, has done some surgery on some very high-profile people, Drew Brees, for example, who just won the Super Bowl, but you have also been involved with some high-profile players in the National Football League. Carson Palmer comes to mind.
Right.
And what exactly did you do working with him?
Carson sustained a very serious knee injury in the first playoff game. Cincinnati was really on a roll. I think they may have gone all the way. And of course, Carson came out of USC and was a very touted and very accomplished quarterback. Sustained a serious knee injury in the playoff game, and I was able to repair the knee ligaments back and help guide his rehabilitation, which he performed back in Cincinnati. And ultimately he got back and played and had a good season this year, had a real good season this year.
I read somewhere that was a potential career-ending injury that he suffered, and you more or less saved the day with it. Is that accurate?
No. So let me tell you how this worked. Okay, this is a very, what happened was, it was not every injury is potentially a career injury.
Right.
All you have to do is have a complication from the treatment, blood clot, or infection. Tom Brady was on the verge of that with his infection after his knee surgery. And so all injuries are potentially career-ending. And the way that came down, which was much to my dismay and Carson's as well, was that after I operated on Carson, and the truth of the matter is that I had just moved to Houston from Salt Lake City, and I was helping the Baylor Medical Center establish a sports medicine center there, much like Jimmy and I have here. And they called and said, the physician from the Bengals called and said, our quarterback got hurt, and we want you to fix his knee. And I said, well, that's great. But I had been busy moving, and I hadn't kept up much on the football that year. And so I didn't realize that it was Carson. They didn't say his name. They said, our quarterback's flying in, and I said, fine. And so I met him, wonderful kid and family, and so we talked about his knee, and it was a serious injury, and it was a little bit more severe than maybe had been let out, and did the surgery. And several hours later, when I came out of the OR, there was about 250 phone calls to return. And I thought, wow, this guy must be really good. So I looked down the list, and normally the professional teams will have someone to help you take all those calls. Right. That's why they'll say, talk to the Bengals, don't talk to me. Right. And of course, they hadn't happened. I don't know why, but it hadn't happened. And so I looked down the list, and there was one particular name that was associated with the wire, and it said Bengals representative for the AP wire. And I thought, well, that's got to be the Bengals guy. So I thought, well, I'll call him first and give him the info so he can handle it. Well, as it turned out, that wasn't true. It was a young reporter for the AP, and one of the first questions he asked me, he says, well, was it a serious injury? And I said, well, of course, you know it was a serious injury. It wasn't the typical football injury. It sustained a very serious injury. And he said, well, is it potentially a career-ending injury? And I said, well, of course, all injuries can be potentially a career-ending injury. That's how that came. And then all of a sudden, like 3 hours later, this is like over the AP wire is career-ending injury for Carson Palmer. Well, the Bengals read it, Carson read it, I read it, and we're all going, "Oh my gosh!" and so it was. That was a. You led right into that one, boy. I'll tell you, that was a hot button.
It was the press out of control, I guess.
Well, it was, and they exaggerated, took it out of context, and it was my fault because normally you don't want to divulge the information unless the patient gives you permission to, right. But I thought it was the Bengals representative that I was talking with. So anyway, that was, yeah.
Take me back. You were a football player in college.
Yes.
Were injured, and that's sort of what inspired you, is that correct, to get into medicine?
Exactly. I played 5 years of college football, and Jimmy's still trying to figure out how I played 5. I said I redshirted a year because I was too little. They were trying to put weight on me. And I had my last year, my senior year, the 5th year, I had been accepted to medical school the year before, and I decided, no, I'd had a good career of college football, and I wanted to play the last year because I was the captain for the defense. And so in a game against Nebraska, I got hit, and it tore the medial collateral ligament in my knee. Not a real bad injury, and ones we treat very quickly now, and most kids are back on the field within 2 or 3 weeks. Well, back in those days, I was put in a big cast from my foot to my thigh, and I remained in that cast for 6 weeks on crutches. And then the Saturday we played Arizona State, they cut me out of the cast, taped my knee, and put me out on the field to play defense again. And of course, I punched the receivers' tickets all the way through to the end zone that day. But I thought, there's got to be something different about these injuries that you can get a player better, right, other than take him out of a cast and put him on a field. And so that did pique my interest as far as, well, there's got to be a better way. And indeed there was. And that was sort of one of the reasons I went into sports medicine, yeah.
What was the main thing you wanted to focus on? What was your sort of end goal? What did you want to be known for once you went into medicine?
Well, without a doubt, the sports injuries. But the knee is a very complex joint, very difficult, wasn't well understood. A lot of surgeries in that area were more debilitating than help. Mm-hmm. And so I really wanted to become a very, very good knee surgeon. And so that was what I studied most and cared the most about.
I hear of people having their knees replaced, and it seems like it just sort of depends upon the person. Some people seem to have really good luck with it, others have some real challenges with it. How much of that is due to the actual surgery itself, and how much of that is due to how well the person rehabs?
It's both. Without a doubt, the technical aspects of how you do a knee surgery plays a huge role in the recovery. But there are things out of everybody's control that can occur. Some bleeding, an infection that for some reason something somewhere was contaminated. And so there can be complications, but fortunately they're few and far between. If a patient has some comorbidities, and what I mean by that is they have heart disease, they have diabetes, if they're overweight, their complication rates go up dramatically. One of the worst is smoking. And if they're a smoker, you can virtually double their healing time and reduce their successful surgery rate by about 20%.
And why is that?
And because just the cigarette smoke and it affects the ability of the body to carry oxygen in the blood, and you need that oxygen and that blood supply to those tissues to heal, particularly in areas where it's rather tenuous anyway, which is generally the knee, ligaments, the shoulder, rotator cuff. These are areas that you need every little bitty ounce of oxygen you can get. And if you're carrying a lot of carbon dioxide from smoking, that's not going to allow it to heal.
So it's not just the lungs and the heart that you have to worry about.
No,
it's everything.
Yeah, and smoking's a big one. Diabetes is a small vessel disease, and so if the same reason, you just don't get all the blood there because of the small vessel disease. So these are things that can affect that, but without a doubt, the technical abilities of the surgeon, the choices he makes, and the desire of the patient to get better are the two major things.
Are we having more orthopedic issues these days because people are more active, or is it just because people are living longer? But it seems like you hear about people having, hip replacements or knee replacements more frequently than you used to. Or is it just that I'm getting older?
You're getting older. But, well, the population's growing, of course.
Right.
But at the same time, the advancement of much of what we do has exploded as well. We all hear about the growing healthcare debt and the healthcare dollar. But what they forget to understand is that the choices available to a patient are infinitesimally more now because of the types of surgeries we can do and the advancements through science of what we've done. And so it doesn't explode just because surgeons want to be busy or because hospitals want to be rich. It's because there's many more available treatments for patients, whether it's orthopedics or heart or whatever, to help them live a healthy lifestyle. And you're right, you are hearing more about some orthopedic procedures such as total joint. And one of the reasons that's the case, and I'm not in a big favor of it, is that a lot of these orthopedic implant companies have gone directly to the consumer. Instead of going to the surgeon and extolling their virtues as to why their prosthesis might be better than another, they go right to the public and they use funny advertising, so to speak, as to why the public should request that prosthesis when they come into our office. And it's very frequent now that the patient will come in with an ad in hand and say, this is what I want. And it's not necessarily any better, could be a lot more expensive, and it may have other associated problems with it that they don't understand.
I think as a large part, as a society, we're more active, hopefully, in exercising and things of that nature. Are there ways that we can do a better job of conditioning ourselves to prevent injuries or taking better care of ourselves? Are we careless, I guess, is my question.
Well, no, without a doubt. I think the point you made is that we have the baby boomers coming on, and so we've been very active through our lifetimes. Now we are coming up with some worn out joints. It's very, very important to maintain a healthy lifestyle, and you definitely reduce the amount of health care you're going to need, and really that's how to reduce the health care dollar, is to go way back, stop having fat kids, stop keeping your kids fat, start a process of healthy living. If you think about that whole concept, it doesn't make a lot of sense, and that is, well, I'm going to go on a diet, I'm going to lose 30 pounds in 3 months, and you do it. Well, 6 months later, you're back 35 pounds. And that's because you haven't developed the cultural change, the real interchange that says, I'm going to live healthy, and living healthy isn't a destination, it's a journey. And so that we need to start way back with the kids, exercise, weight reduction, eating healthy, get rid of the Cokes out of the schools, stop the McDonald's burgers. And I'm sorry for using those names, but and start to teach our kids and ourselves a healthy lifestyle. And in doing that, I think we'll live longer, but we'll also live healthier. Flexibility, strength is great for joints, and being lightweight, not heavy.
exercise for, and I'm not talking about for the weekend athletes, so to speak, but just for the average person, what are the best types of exercise? Number one, to maintain, healthy heart and lungs,
right,
but also just from a joint and muscle standpoint.
Well, for the most part, keeping yourself at an ideal weight, and in doing that, you want to get your heart rate up 3 or 4 times a week for about 20 minutes. It doesn't take a lot, and you can do it walking. In fact, running excessive miles isn't necessarily good for your knees, and guarantee it's not. And people get away with it, but you can certainly do low-impact exercise for your heart, get your weight down, and it doesn't take beating the pavement on a marathon. So the heart, yes, you want to do cardiorespiratory exercise about 3 to 4 times a week for about 20 to 30 minutes minimum. I mean, that does it for you. You also want to include strength and flexibility exercises. Keeping your muscles toned keeps your joints healthy. When you have strong muscles about your joint, any kind of forceful impact lets those muscles absorb, much like springs, away from the joint surfaces, which will tend to wear. And so that's also a good way to keep your joints healthy. Flexibility, we tend to lose more flexibility as we get older than strength. And usually with the lack of flexibility, that means you're going to start getting joint pain, particularly back. When you sit without good flexibility, your back gets really tight. And this is why as you start to get older, you'll start to have more back aches. And if you keep your back flexible, your hamstring stretched, doesn't happen.
What are some good things to do in order to do that?
Just that alone. You want to do good abdominal strengthening, which supports your back. Core strengthening.
Right.
Pilates is one of the famous
right.
Exercises now that everybody's into. Very good as far as core strength, central strength. Flexibility as far as the spine goes, abdominal strength, hamstring stretching. And the reason that's important is the hamstrings cross both the knee and the hip into the pelvis. So if they're real tight, you'll walk more like a gorilla. You'll walk with your knees bent, your hips bent, and your back flexed. And that'll cause an increased strain through all of those joints. So being more flexible allows you to walk straight up and without the force on the kneecap or the hip or the back.
And you can achieve that just by something as simple as basically getting on the floor and stretching. I mean, it doesn't have to be any kind of fancy.
Yeah. It's interesting. I'll see folks come in with back pain, and all I teach them is how to stretch. Just stretch out your hamstrings, or how you stretch out your back, and they're better. And they thought they were headed for back surgery. And so there really is a lot to maintaining good flexibility, strength, and health.
Let me switch back over to sports. I mean, in this country, football is huge, and recently there's been an awful lot of talk about some of the injuries that these guys are sustaining. I mean, they're bigger now, they're faster now, and it seems like every year they're just bigger and faster.
Yeah.
And it's even trickling down to the high school level and maybe even down to the grade school level. What is your advice to parents if their children are starting to play football?
Well, that's a good question. It depends at what age. I'm not a big advocate of the kids starting younger and younger. I certainly want them to. I think they need to play team sports. I think they need to learn how to play nice in the sandbox.
Right.
And be coached and disciplined for sure. What I don't agree with is, of course, the heavy contact that early to a growing skeleton. Now, most of the folks that show great sense with that, they develop a flag football program, and they don't really get into the head knocking and the hard hits until they get higher into high school levels. But without a doubt, some of the parents and coaches go overboard and are quite zealous with the idea of, well, this is how I played, so you're gonna suck it up and hit,
Right.
And to that note, my son was an excellent athlete, and I didn't let him play football until later. I had him play soccer. I wanted him to learn a team sport. I wanted him to learn how to play with a team. And then when he got into the high school level, then he played football. And not only that, but he could kick the ball, which a lot of kids can't. and so that was my way of introducing my son to football. Having played many years of football, I actually coached Little League football. And I find that we're there to teach different principles at that age. We're teaching teamwork, camaraderie, discipline, how to use your brain and your body, and not necessarily how to knock somebody's head off.
Right, right. Just wondering, because there has been a lot of talk in recent years about all the issues that these former NFL players have had, you know, physically as well as mentally. What are your thoughts on that?
Without a doubt, it's true. Now, they would tell you that it is hyped. It's not necessarily true. I personally suffered the same exact thing. When my last year of college football, again, besides my knee injury, I sustained a concussion. And I was put right back in the game. And I sustained another concussion. And I had, by the time my senior year was through, I'd had 3 concussions. And they were short and brief, but never time to really heal. And truthfully, even though I was invited to training camps in the pro league, those concussions were what really kept me out. I wanted to be a doctor, but I knew that every time I got my head hit, I was going to lose a game. And I didn't want to lose a lifetime. And so I went to medical school. But sure enough, a few years later, I played in an alumni football game, got my head hit, had a concussion. And so once that happens, it happens repeatedly. Steve Young, great example, good friend of mine. And it's real. And you're going to see a lot come down as far as modifying how the game of football is played, hopefully. And helmets aren't necessarily the answer, because inside that helmet the head still moves, and the brain still moves inside the head, and that's what creates the issue. It's not necessarily how soft the helmet is or hard, and so, you know, I see the game moving, I don't know how fast, but not fast enough, towards more of a less head involvement, much like rugby, and playing more like rugby, and not spearing, not hitting. We send out videos a couple of years back called Heads Up to, I don't know how many, 10,000 or so videos out to all around the United States, just teaching high schools to teach players how to keep their heads up, not use them as a spear. And when I played, that was the technique. You were taught to spear right into the numbers. And so a lot of neck, a lot of head injuries. And now with some of the rule changes, I think it's getting less, but still not enough. The concussion issue is a big one.
Do you think the game just overall right now at the NFL and college level is too violent?
I don't know that it's too violent. I think, you know, it's a controlled violence for sure. I think that there's some injuries that are like the head injuries that have not been apparent, that are a result of the game, and with hopefully some rule changes and some different techniques taught and an approach that really does prevent this head-on contact, it will be okay. Now, that's a matter of technique, not necessarily violence. Boxing, is it violent? Well, that's also technique, but it's violent. So I don't want to say too violent. It's a violent sport, and I think that controlled violence, maybe controlled aggression, is the way to go.
And as we look into the future, what are some of the medical advances that are on the horizon that we can get excited about? I know over the past few years there's been an awful lot of talk, you know, about stem cell research and things of that nature. Give me your thoughts on what we can look forward to.
I think it's a very bright future in that area. You know, we see nowadays, we open the newspaper and there's these full-page ads with all these surgeons standing with their arms folded saying, we're the joint replacement experts, right? Well, the fact is, you don't want to be there getting your joint replaced. Okay, you want your joint. And so what we're really doing hard at the Andrews Institute is joint preservation. So we consider ourselves the joint preservation experts. And what I mean by that is that when there's an injury to the knee, we don't want to go in and operate and leave some spare parts in the bucket. When we leave the OR, we want to put them back in. And in doing that, you have to be able to transplant a cartilage, transplant a meniscus, put a ligament in the right spot, in the right anatomic configuration. And there's a lot of that happening with stem cells and what we call platelet-rich plasma concentrates, where we can take the patient's own blood, spin it down, get their growth hormones, and enhance the healing capacity of a damaged cartilage or bone fracture. So I think you'll see a lot of what's called joint preservation in the future instead of joint replacement.
What kind of time frame are we looking at for that? I mean, is that something we can expect in a couple of years?
Oh, it's here now. It's here now. And in fact, we just started the very first fellowship called Joint Preservation Fellowship in the United States here at the Andrews Institute, and we just started it 2 months ago, just because of the techniques that we're constantly developing. And that's where the research pays off, because you can develop the devices, go to the research lab, determine it mechanically, go to the animal situation where you may, I have to say this, not sacrifice animals, but you can work with them and you can inject them with their own blood and see how they heal, things of that variety. And without a doubt, some of that is important research, but not the old type where you do damage to animals. But in any event, the idea is that you can develop these techniques for the human race, and we have definitely done so. So we're already using stem cells. We're already using much of the growth factors to enhance bone healing, ligament healing, and cartilage healing. And that's the whole idea of joint preservation. Let's preserve the joint.
We've got about roughly 2 minutes left. I'm going to shift gears just totally here, because there's been so much talk about health care and physicians. Is there going to be a shortage of physician and health care workers moving forward? No.
I don't think so. Now, again, I'm old school. That's at least my partners tell me.
Yeah.
And there's too much gratification in treating patients in that capacity and helping people. And one of the reasons I think medicines and physicians particularly are in the shape they're in right now is that we didn't pay a lot of attention to all of the behind-the-scenes negotiating that insurance companies and hospitals could do. And we were out treating our patients, and all of a sudden we turn around and, geez, we're not getting paid a salary like we used to. And as an example, 10, 15 years ago, I might get paid $1,000 for a surgery that I did, and the hospital got paid maybe $1,000 for where you did it. Now the hospital gets $10,000 and I get $500, and that's somehow that formula doesn't make sense.
Right.
But that's what's happened due to the hospital systems and the insurance companies. If they want to solve healthcare issues, they need to level the playing field. We did that with the government. We have a check and balance system in the government, and there is no check and balance system right now in medicine. Hospitals can own physicians. Insurance companies can own physicians and hospitals. And so if you have a conglomerate that owns the physician, the hospital, and the insurance company, what hope do we have as patients to have any control of that?
Yeah. We could do an entire show on that.
Yeah.
Dr. Lonnie Paulos, it's been a real pleasure.
Thank you.
We've learned a lot.
Thank you.
Appreciate it. Dr. Lonnie Paulos from the Andrews Institute, and of course he's also involved with the Andrews-Paulos educational part of the Andrews Institute as well. We greatly appreciate you joining us for this edition of Conversations. I'm Jeff Weeks. I hope you take very good care of yourself, and remember, Dr. Paulos says stretch. That's a good idea. I'm going to keep that in mind. We'll see you next time on Conversations. We'd love to hear from you. Check us out on Facebook and search Conversations with Jeff Weeks.